Today is a very basic topic of atopic dermatitis. Atopy means allergy. So A for atopy, and A is for allergy. Okay, let's talk about how does it happen. The mutation of which gene is responsible for this? Filaggrin gene. Filaggrin gene is responsible for this. Obviously, there is a defective skin barrier. इसके अलावा what is happening? Lymphocyte abnormality is happening. So immunological change क्या होता है? Immunological change is happening in lymphocytes. So lymphocytes responsible for our immunity. So that is also that's compromised. Abnormality वहाँ पे आ रही है. और हमारा response क्या है body का? Immunoglobulin E increase होता है. तो जब भी allergy होगी तो immunoglobulin E levels will be tested. If they are increased, that means there is an allergy component present, otherwise there is nothing. Now, associated features, you can learn three. First is asthma, of course, is allergy driven. Then allergic rhinitis, it's allergy driven, and ichthyosis vulgaris, where there's a lot of dry skin, flaky scales on all over your body, and ichthyosis vulgaris, allergic rhinitis, and asthma. These three you can remember. Now, the phases. First is the infantile phase, the childhood phase, and the adult phase. So, infantile phase, you can just remember this. That's how the child will be growing up, and these are the phases of life as well as the phases of atopic dermatitis. Now, infantile phase happens around 2 to 3 months. So, infant is up to 1 year, and 2 to 3 months तक infantile phase हो रहा है. It is very itchy, but because kid cannot do this, infant cannot scratch. So there are no lichenification marks. Lichenification means thickened skin because of the constant itching, constant scratching of the skin. It is mostly happening on face. Here you can see atopic dermatitis on face. So red, itchy skin with scaling. It is happening in on cheeks. This is infantile phase, and of course diaper area is spared. So there is no dermatitis or any component of dermatitis in that diaper area. So diaper rash is completely different from atopic dermatitis. You can definitely rule out atopic dermatitis in that area. Now the next phase of life is childhood phase. So again, for atopic dermatitis, it is the same thing, 2 to 12 years. Again, very itchy and leathery flexural lesions. So these are the flexures of the body, back of your knee thing, and yeah, so very itchy, red, swollen, and they're bumpy, red, brown, itchy, bumpy, and eczema on the back of the knees. So this is childhood phase, and then adult phase. Again, lichenified means thickened because of the constant scratching. Flexural lesions means in the flexural parts of the body, ear, and most example is nummular dermatitis. Cheilitis means the dermatitis around the lip area, nipple dermatitis, and the hand dermatitis. So all of this, and then how's the criteria? So major criteria, more than 3 symptoms should be present, and minor criteria, more than 3 symptoms should be. So Hannifin and Rajka's criteria is used for this, and must have 3. What is this must have 3? It's the more than 3 symptoms out of these, and must have 3 from the minor, which is more than 3 symptoms from these. So I have written it very clearly for the mugging up also. So must have 3 pruritus, should be really itchy, facial and extensor involvement in infants, and flexural lichenification in adults. So itchy, face and extensor involvement in children, flexures in adults, and yeah, there should be a family history of atopy if there's asthma, allergic rhinitis, or atopic dermatitis, then this is must. More than 3 if you have, okay, great, AD. Now in the minor category, associated cataracts, associated conjunctivitis, colitis. So this is about eyes, this is about lips. Now we go back to now we come to hands. Hands dermatitis, hyperlinearity of palms, like these palm, hyperlinearity of these lines, like बहुत गहरी lines दिखेंगी. So this is hyperlinearity of palms, and ichthyosis is very scaly. Again, in now infections or immunoglobulin E levels are increased. Apart from that, nipple dermatitis, orbital darkening, wood intolerance. You don't need to get into that much, but yeah, this is major and this is minor. More than 3 and more than 3. So all that. Now come to complications. Of course, when there's a lot of scratching, lots of seeping, so there's bacterial infection and the viral infection, and immunity is also compromised. Then also bacterial and viral infection will happen. Treatment. First of all, avoid triggers. Do not scratch. Woolens avoid करें, pollens avoid करें. Then general measures में hydration is very important because dryness can also aggravate the scratching part. So compresses, soaps, baths, topical emollients, moisturizers, all of this. Antihistamines very important because हमारा IgE बढ़ा हुआ होता है. एलर्जी को कंट्रोल करने के लिए एंटीहिस्टामिन लेना बहुत जरूरी है. Specific flares. We were talking about the treatment part. We have discussed trigger avoiding, hydration, antihistamines we have discussed. Now when there is an acute specific flare, what happens then steroids, very important. Steroids are very important that way. Then maintenance treatment should be steroid sparing, so we'll go for immunomodulators, tacrolimus. Tacrolimus is immunomodulating, and that can be used for maintenance treatment. For extensive, chronic, and recalcitrant recurrent disease, oral steroids should be used with topical therapy. Of course, topical therapy is very important, बस oral steroids भी देने हैं साथ में, और साथ में immunosuppression करना है क्योंकि system is hypersensitive. अगर hypersensitive system है आपकी body, when I'm referring to system, it's body अगर hypersensitive है, उसकी सेंसिटिविटी को हमें कम करना है, तो हमें इम्यूनोसप्रेसेंट देने पड़ेंगे ताकि हर एलर्जन के कांटेक्ट में आके वो एक रिएक्शन शो ना करे. सो साइक्लोस्पोरिन और मेथोट्रेक्सेट कैन बी यूज्ड. एंड ऑफ कोर्स अगर ये भी काम नहीं करता है, देन फोटोथेरेपी इज वेरी इंपॉर्टेंट. यूवीबी, नैरो बैंड, एक्साइमर लेजर, ये सब आप कर सकते हैं. तो दिस इज हाउ वी go slowly while treating, while diagnosing atopic dermatitis. Just remember, atopic is an allergy. So just consider allergy if you see anything in this area: red, itchy skin with scaling, flexures in these areas, thickened area of wrist and hand with scratching marks, scratch marks, very important. And if there is accentuated hair follicle, like these hair follicles are there, but you can see the darkening, thickening of the hair follicles, so you can consider follicular eczema. So eczema is an interchangeable term with atopic dermatitis. One should definitely go for it. Biopsy is mostly not required, but in lab test for diagnosis, I would say IgE levels first, then comprehensive allergy panel, and patch skin testing, PST, patch skin test. Comprehensive allergy panels containing 110 or 120 allergens and the sensitivity done by blood itself, and Ig is the whole generalized IgE levels for the allergy part. So this is how we do the atopic dermatitis workup.